Oh my God.
This morning, our
things have
retiree information session.
I think of
Again, it's quite
the
timely
days
this morning
you were
with
a
the
tax
change
district.
in the Medicare Advantage plan, shifting from Humana.
I should have worn my hearing aids. I
over
can't
to
hear.
the Anthem plan. But I wanted to let you know as well, this is one of several that we'll plan throughout our school year to bring our retirees in for all kinds of different sessions to learn about benefits and other programs associated with the insurances that you may be enrolled in. So I just wanted to welcome you again. My name is Alicia Koster. I'm the Assistant Superintendent for the district. And I just wanted to take a moment before we begin to introduce some of the key members of my staff, many of which you know or at least have spoken to on the phone or through email. So I have Jacqueline Fusler, who's our Administrative Assistant in Human Resources. I have Alyssa Smith right here, who's our other Administrative Assistant. And Deb Callery's hiding in the back. Everyone knows Deb. Deb was a nice addition to our team over the last year, and she can never retire. She cannot leave us. So thank you, Deb. Thank you for being here this morning. The other introductions that I'd like to make, I have Kim Parker here, who is a representative from Anthem. She will lead much of the presentation this morning, as well as Jason Ellis. He is our senior advisor from NFP, who is our insurance broker, and assists with a lot of the coordination between the district and our insurance plans. So just a couple things this morning. We do have members joining us virtually through Google Meet. If I can ask those joining us virtually to please mute your microphones during the session. We will at the end leave time for a question and answer period. So the presentation is about a half hour. We'll leave about a half hour for questions, both from the in-person audience and those that have joined us virtually. So with that, and also we are streaming this on YouTube. So this session is streaming live currently and will be recorded. I will send out instructions later on. This video will be placed on our district website, along with the presentation from today as a reference to you. If you'd like to look back, if you leave the meeting today and questions come up, you can feel free to reference this information on our website. And of course, you can give one of us a call if you have additional questions after today's meeting. Okay, so thank you again for joining us, and I'm going to turn it over to Kim at this time. Thanks.
Thank you, Alicia. I appreciate it. Can everyone hear me good? Okay. Well, first and foremost, as Alicia said, thank you very much for coming out today. We have a nice turnout. I'm hoping that today's presentation you'll find will be informative and really proactively address many of the questions that you have top of mind. So what we'll go over today is really just a recap for all of you in regards to how Medicare Advantage works. This is not something new because you're currently on a Medicare Advantage plan today, but we'll do a quick recap of that. We'll go through the medical benefits of the program, the pharmacy benefits, some additional enhancements that come with the program, and then lastly, we'll talk about the enrollment process. But before we get started, I just want to let everyone know that your pre-enrollment guides, which will look like this, were shipped by expedited mail, so the likelihood is you may get them by Saturday, latest by Monday. And in the pre-enrollment guide, it will have a lot of the same information that was included in that initial announcement letter that you have, but it'll have the full summary of benefits for your medical and pharmacy coverage. Now, just to give a quick recap of how Medicare Advantage works. Medicare Advantage programs are administered by private insurance carriers like Anthem and Humana to administer your Medicare benefits. So everything that's covered under traditional Medicare, Part A, which is your hospital portion of Medicare, and Part B, which is your medical portion of Medicare, are covered under the Medicare Advantage program. It also includes your prescription drug Part D coverage. So it combines all of those pieces together into one program. So you will continue to have one identification card for your medical and pharmacy services. The only thing that's going to be different is it's going to be an Anthem Blue Cross Medicare Advantage card as compared to your current Humana identification card that you have today. So combining everything together, as I said, it creates a seamless and comprehensive program for members, and it also means that you only get the one explanation of benefits, so those explanation of benefits will be coming directly from Anthem Blue Cross. Now, in addition to all of the required benefits that a Medicare Advantage carrier has to cover, these programs also include a whole host of additional enhancements that traditional Medicare does not cover. So just to name a few, you have your meal benefit, vision, hearing, silver sneakers benefits. So all of those are included in the Medicare Advantage plan. Now, since we're contracted with the federal government to administer your Medicare benefits, we as a Medicare Advantage carrier follow the same Medicare coverage guidelines and Medicare medical necessity guidelines. So if it is a Medicare covered service, it's required to be covered under the Medicare Advantage plan. I do always like to open these retiree meetings talking about the fact that the Anthem Medicare Advantage program is not simply a payer of claims. Obviously, we're going to be paying your medical and pharmacy claims, but the program is truly a healthcare delivery system for our members. And what I mean by that is we take an active role in helping our members get the most out of their health plan and helping our members manage their chronic conditions better and ultimately have better health outcomes. And that could be something as simple as sending out reminders to have your wellness screenings done. Or it could be you're going through a very complex illness and you may benefit from a care management nurse that can help you navigate through a very complex healthcare system with regards to follow-up testing and follow-up care that you might need. So our ultimate goal is to help our members have better health outcomes. And we do that by really looking at the holistic, whole person, rather than individual disease states. One of the very first questions I do get in every retiree session has to do with providers. And this is really the main reason why you're here today. The main reason why the school district is switching from Humana over to Anthem. Your access to providers. So the program is a national PPO program, so members can live in any of the 50 states of the United States or U.S. territories, and you'll access the national Blue Cross Blue Shield Medicare PPO network. So it's over 1.1 million providers that participate with the National Blue Cross Blue Shield network. So the likelihood is many of you are probably utilizing Blue Cross Blue Shield providers today. I personally want to call out Albany Med, New York Oncology Hematology, community care physicians. All of those providers are in-network participating providers with Anthem. But you're not bound to in-network providers only. Now granted, there's over 1.1 million providers that are in-network, but you have the freedom to see any Medicare provider, even out of network. So if you see a Medicare provider that's not a Blue Cross Blue Shield provider, you can still see that provider, and the cost share is going to be the same. So you're not going to have a higher cost share for a provider that's not in our network. Now, for those individuals that are not in the local New York area, you might be a retiree that lives out of state, maybe North Carolina or Florida, or you might be a snowbird. You have access to all of the Blue Cross Blue Shield providers nationally. So, for example, when you're in Florida, those providers participate with Blue Cross Blue Shield of Florida. If you're in North Carolina, it's Blue Cross Blue Shield of North Carolina. So it's important to note that the providers participate in the Blue Cross Blue Shield national network. But once again, you're not bound to network providers only. You can go in or out of network. A couple of easy ways for you to confirm if your providers are in the network, even though you're not bound to in-network doctors only. The easiest way is for you to call our First Impressions phone number, which will be included in your pre-enrollment guide, and those individuals can look up the providers on your behalf. Or if you want to go on to anthem.com, you can use our Find Care tool. You do not need to be a member yet, so you can search as a basic guest. And if you search the anthem.com Find Care tool, search as a guest, you're going to choose the medical network. You'll choose how you get your insurance. It's going to be through Medicare. You'll choose the state that you want to search providers in, and then the network is going to be the Medicare Advantage PPO network. And you can look up providers based on city and state, zip code, specialty type, and provider name. So you have the ability to search directly on the anthem.com Find Care tool. Another question that comes up is in regards to referrals and prior authorization. So under the Anthem Medicare Advantage plan, you do not need referrals to see your specialist. So you do not need to get a referral from your primary care doctor in order to see your specialist. However, similar to how the Humana plan works today, there could be some services that may require prior authorization. And this is the pre-approval process that's done on the front end to ensure that that service meets Medicare guidelines and meets Medicare's medical necessity guidelines. The providers handle this process behind the scenes directly with us. So the prior authorization process is not something that you as a member handle. The providers handle that directly with us. And similar to Humana, some of the services that require prior authorization are your planned surgeries, your complex diagnostic testing like CAT scans and PET scans and MRIs, your therapies like your physical and occupational therapy and infusion therapy. Think of it as your big items are the ones that would require the prior authorization, which is handled directly between the doctors and the plan. So very similar to how it works with Humana today. Now this is difficult to see, but I'll give you a quick high-level snapshot of the medical portion of your benefits. The program was set up to mirror the same plan design that's in place with Humana. So currently today you do not have a deductible under the Anthem Medicare Advantage plan. It's zero deductible under the program. Your primary care physician copayment is $5. I think that's a little easier. So you have your primary care physician copayment is a $5 copayment, as well as your specialty visits. So whether you see your primary doctor or a specialist, those visits would be a $5 copayment. Your inpatient hospital care is covered 100%. So there's no copayment when you go into the hospital, and you have 365 days of hospital coverage for the year. If you go to the emergency room, there is a $25 copayment, but what's important to note is if you go to the emergency room and you're admitted into the hospital within 72 hours of that emergency room visit, that $25 copayment is waived. So you would not be responsible for that emergency room copayment if you're admitted into the hospital within that 72-hour period. All of your preventive screening, so your full head-to-toe annual physical, mammographies, colonoscopies, PSAs, all of your preventive screening is all covered 100%, so you pay a zero copayment for your preventive and wellness screenings. Now, under the program, there is a maximum out-of-pocket, so all of those $5 copayments that you pay count towards your maximum out-of-pocket. The likelihood is no one will ever reach this. It's a $3,000 maximum out-of-pocket for the year. So if, by chance, you happen to have a lot of doctor visits, once you reach that maximum on the medical portion of the plan, it would be 100% coverage. Now, in addition, the program also includes hearing, vision, routine foot care, and dental benefits. So under the program, you do have coverage for hearing exams and hearing aids. So you can go to any audiologist for your hearing exam, and that's a zero copayment for your routine hearing exam. You have a hearing aid allowance of $500 per year for $1,000 in total for both years, and that's every 3 years. Now, the hearing aid benefit is administered through our preferred vendor, which is Hearing Care Solutions. So you can go to any audiologist that you want for the hearing exam, but that audiologist would order the hearing aid through the vast catalog of hearing aids that Hearing Care Solution has to offer. What's nice about utilizing the preferred vendor is that $500 goes a lot farther because we have a reduced contracted rate with Hearing Care Solutions. You also have benefits for your routine eye exam as well as eyewear allowances. So your routine eye exam is covered every year, zero copayment for your routine eye exam, and you also have a $200 allowance towards eyeglasses, and that's every year. So there's a typo on the screen here. It's not every 2 years, it's every year you have a $200 allowance towards your eyeglasses or contact lenses. You also have routine foot care. This is covered under traditional Medicare only for a diabetic member. Under the Anthem Medicare Advantage plan, routine foot care is covered for all members. So routine foot care is the clipping of the toenails and callus removal. You have 12 per year of routine foot care visits, and that's a $5 copayment for routine foot care. You also have dental benefits that are included in the plan, and it's preventive dental coverage. So you're covered for your annual exam, as well as your full set of x-rays, as well as 2 cleanings per year. So you have full coverage, zero copayment for your exam, x-rays, 2 cleanings per year, and that's through the Anthem Preferred Network, which is Liberty Dental. So Liberty Dental is the network that the dentists participate in. But if you go to a non-Liberty dentist, you do have coverage out of network. So all of those services will be covered 70% by the plan, and you would be responsible for the 30%. Want to touch upon your prescription drug coverage. So under the program, you have something that's called a select drug tier. And this is your more commonly prescribed generic prescriptions to treat cardiovascular conditions like high blood pressure, diabetic medications. So in your pre-enrollment guide, there will be a sample listing of select drugs that fall under this tier. The likelihood is I can guarantee you there's a couple of people in this room that's taking at least one of those prescriptions. Those prescriptions are covered at a zero copayment. So you'll pay no copayment for select generic drug tier. For your next tier is your generic drug tier, and that copayment is also zero. And then your preferred brand name drugs is a $7 copayment for a 30-day supply, and your non-preferred brand name drugs is a $10 copayment for a 30-day supply. So these are the copayments for a 30-day supply at the retail pharmacy. You also have the ability to get your 90-day supply of maintenance medications, so 3 months at a time, either through mail order or at the local retail pharmacy. So if you fill them at the local retail pharmacy, you're still only going to be responsible for that mail order copayment. So for generic prescriptions, it's a zero copay for a 90-day supply. For preferred brand name drugs, it would be a $14 copayment for a 90-day supply. And for non-preferred brand name drugs, it would be the $20 for a 90-day supply. For anyone who's taking a specialty medication, that would be limited to a 30-day supply only. So that particular drug would be a $10 copayment for a 30-day supply, either through mail order or at the local retail pharmacy. For anyone who is currently utilizing the Humana mail order program, you will need to get new prescriptions. So your open refills that are with Humana will not transfer over to Anthem. So if you want to use mail order, or if you're using mail order today, you'll need to contact your doctor, get new prescriptions, and you can fill them at the local retail pharmacy, or when you get set up under the Anthem Medicare Advantage plan, you can log onto the member portal and get set up for our mail order program, or you can call the pharmacy phone number that will be on the back of your identification card to get set up for mail order as well. So I just want to let everyone know, if you're using mail order, you will need new prescriptions. If you're filling them at the local retail pharmacy, you don't need new prescriptions. You just need to make sure that you show the pharmacist your new Anthem Medicare Advantage card after June 1st. The Sydney Health app, this is the mobile health app that you can download directly from the App Store to your smartphone. So the Sydney Health app allows you to access all of the same things that you would access under the member portal when you register as a member on Anthem.com. You'll be able to view your benefits, review claims, look at EOBs, chat live with a representative. You can also download a digital identification card, get set up with home delivery mail order if you choose to. So you have the ability to have everything in the palm of your hand utilizing the Sydney Health app. Now, before June 1st, everyone will be getting their identification cards in the mail. On the identification card is going to be a little a sticker with a black QR box. That black QR box links you to Sydney. So when you get your ID card, you can access the Sydney app directly by the QR code and then peel that sticker off. Live Health Online is our virtual doctor visit platform. So you will have the ability to have a virtual doctor visit with a board-certified physician on your smartphone, your iPad, tablet, or your computer. And quite often our members will utilize the virtual platform if it's after hours and your regular physician's office is closed, or weekends, or it could be inclement weather and you don't want to get out to your doctor's office and you know that you have something that you might just need a prescription called in for, or you just want to have a virtual doctor visit with a physician. They're available 24 hours a day, 7 days a week, and the virtual doctor visits are a zero copayment. And after that virtual visit, they will send a summary report to your regular family physician. My Health Advantage is part of the Anthem.com member portal experience. So one of the other things that you'll do when you get your identification card at the end of May is you'll go on to Anthem.com, register under the member portal. So this will allow you access to all of your benefits and everything right on the member portal. But My Health Advantage is part of that member portal experience, and it's a repository that allows you to put all of your health records in one place. So it allows you to track your appointments, your test results, put reminders in. It also pushes out reminders for you to have certain tests done. We could have a diabetic member where we don't see there's any glaucoma screening that's being done. We may push out a reminder through the My Health Advantage that as a diabetic, you really should have that glaucoma screening done as part of your routine healthcare screening. So you can pretty much house all of your health information in one safe spot under the My Health Advantage. The 24/7 nurse line, this is different from the Live Health Online virtual doctor visits. This is a nurse line that's staffed by registered nurses, available to you 24 hours a day, 7 days a week, as the name refers to it. That number will also be on the back of your identification card. And the purpose of the nurse line is really to answer any kind of medical question you have. Quite often our members will utilize this in the middle of the night when they're exhibiting some symptoms. They don't know if it's something they should go to the emergency room for right away, or it could be something that could wait until the morning. They're really there to help assess and triage your symptoms so that you get to the appropriate point of care. I had a personal colleague of mine utilize the nurse line a few months ago. She woke up in the middle of the night with shortness of breath and a heaviness in her chest. And it was more of an annoyance to her. And she said, I'll just go to urgent care in the morning. And she said, let me call the nurse line and get a professional's opinion on this. And she called, and the nurse listened to what she was talking, her symptoms, and she said, Trish, I think you need to get to the emergency room right away. And it's a good thing she did, because she was having a pulmonary embolism, and if she waited until the morning, she may not have made it to urgent care. So our members, you utilize this nurse line, as I said, for any medical question that you have whatsoever, and it's available to you any day, any time of the day or night. Silver Sneakers is included in the Medicare Advantage plan, so you'll have access to all of the same Silver Sneakers locations nationally. There's over 17,000 Silver Sneakers gyms that participate. It's a portable program, so it goes with you wherever you go. So if you're traveling on vacation in Arizona and you want to utilize the Silver Sneakers location in Arizona, you can do so. If you're a snowbird, utilize it, Silver Sneakers location in Florida. So this membership goes with you wherever you go. You're not locked into one specific location. And Silver Sneakers also has, in addition to their brick and mortar gym locations, they also have flex classes that they offer outside of the gym setting. There's on-demand and virtual classes that you can do in the privacy of your own home directly through silversneakers.com. Healthy Meals is part of the Anthem Medicare Advantage plan, and members will be eligible for up to 56 meals delivered to their home each year. It's primarily designed for post-discharge from the hospital. So the last thing you want to think about when you're being discharged from the hospital and coming home is having to cook for yourself. So you'll be eligible for 14 meals per discharge delivered directly to your home for up to 56 meals per year. You could also qualify for the Healthy Meal benefit if you're a diabetic member and your A1C is elevated above 9 or above, or if you have a body mass index of 25 or more. So you will have the meal benefit that's included in the plan. We also have the house call program. So all members will be offered a house call visit where a clinician will come into your home and do a full health evaluation. They'll review through your medications, go through all of your medical questions, review through some basic health screenings, biometric screenings, provide a summary report of that house call visit back to your family physician. This is voluntary, so this is, if you don't want to have a clinician come into your home, you can say thank you, but no thank you, but it will be offered to all members. I also wanted to point out that Medicare, CMS, which is the Center for Medicare and Medicaid Services, requires that we do a health risk assessment outreach phone call to all of our newly enrolled members within the first 90 days. So everyone in this room will get a phone call from Anthem anytime between June through the end of the summer. And the health risk assessment is just a couple of simple health questions that they'll ask you. And it also helps us identify a high-risk member that may benefit from one of our clinical outreach programs or a care management nurse. If we cannot, we'll try to reach you 3 times. If we can't reach you, we'll send you a postcard in the mail asking you for you to call in. So we're required to make the attempt for outreach, but it's not a requirement for you to do the health risk assessment if you don't want to. Medicare Community Resource Support. This is a team of individuals that helps connect our members with the local community resources available in your own backyards. Many of us do not realize the amount of resources and support that's out there because we just don't really know where to look for it. This team does all of the legwork and research on your behalf. And it could be something as simple as connecting a member with a local food pantry or utility assistance program, copay assistance program. We actually had a member in Queens, New York, get connected with a local church, and they came in and helped build a wheelchair ramp on the house for his wife. So this team is really there to connect you with the local resource that's available to you in your community. Special offers is our discount program that's available to all Anthem Medicare Advantage members. You'll be able to access the full list of participating vendors when you register under the member portal under anthem.com. And these vendors offer their products or services to our members at a discounted rate. So the discounts range from 25 to 50% off, and it could be for services, it could be for a Fitbit, it could be contacts, eyeglasses, LASIK surgery, the hearing aid vendors in there. There's Garmin, so there's a whole host of vendors that offer their services at a lower rate to our members, and you can access that once you register under the member portal. Lastly, I just want to recap with a couple of items. So all of the retirees from Greater Johnstown will be automatically enrolled. You're going to be lifted and shifted from Humana over to the Anthem Medicare Advantage plan. So there's going to be no gap in coverage. It's going to be a seamless transition. It will be an automatic process. All members will receive their Anthem Medicare Advantage ID cards in May, probably towards the third week of May. And you'll also get a welcome kit from us, and that will go into a little bit more detail on how you can access certain parts of the benefits, how you can access your evidence of coverage. So the first thing you'll receive is your ID card, and then you'll receive your welcome kit. All members will need to continue to pay their Medicare Part B premium, which you pay today. It automatically comes out of your Social Security check, so that's not changing. So the mechanism of how everything's working under Humana today will be the same type of process under the Anthem Medicare Advantage program. So it will be a seamless transition rolling over. I will say if anyone is in the middle of treatment, or if you know you're going to have surgery or something done at the end of May, close to June 1st, make sure your providers know that your insurance coverage is switching from Humana over to Anthem's Medicare Advantage plan for June 1st. This way, they're aware of it, and if there's anything that they need to do internally with us, they have the information. So that's the only thing. If you know you're having something done, or you're in the middle of something, just make sure your providers know that the coverage is changing. So I will open it up to questions from both the live audience and the virtual.
Thanks. So just a couple of things. We're going to open it up for questions, but what I am going to do is alternate between those that have joined us virtually. Jacqueline will take the questions, and we'll allow some of the questions to come from the virtual audience as well. If anyone did experience reception issues, once again, this is streaming on our YouTube channel. I am going to place it on our website immediately following this meeting, along with the presentation. I also do want to share that as part of our outreach in support of our retirees, once you receive your membership cards, if there's an interest, I can set up another mini session where we can help you get set up on the Sydney app. If you want to learn a little bit more about the search tool to use, because it is very, very helpful, not only to find providers, but you might want more information about the coverages, the various coverages under the plan. I can set up another time for retirees to come in a mini session and join me in the district office, and myself as well as my staff can help you get set up. So that's something that we can help you with once you receive your cards. We can also do it as a follow-up session as you leave here today and you're thinking about your insurance changing over to Anthem. We can also have a follow-up with any questions that you might have a few weeks from now. So I can go ahead and I can set that up for the May time frame. One of the things that I think that I want to just start with the first question, if I may, is because we've been, Deb Calorie as well as my staff, we've received questions during this, what we understand to be a very stressful situation for many of you in thinking about your provider changing from Humana over to Anthem, as well as hearing all the news about the various negotiations that have been occurring with New York Oncology and Albany Med System, and wondering what the heck's going on, right? And unfortunately, the districts that are involved in these plans, as well as you as retirees, were kind of thrown in the middle of these negotiations. So we understand the stress that this caused all of you, so we want to do our best to sort of help you and sort of provide that white glove service so that you do see that smooth transition, and hopefully as of June 1st, we've alleviated any concerns that you may have. But one of the big questions that we've had, Kim, I think, and I think you addressed many during your presentation, so thank you, is talking about when someone goes to an out-of-network provider, what that could mean in terms of service in the doctor's office, with billing and that. So if we can start with that question, that's probably the second largest question we've received.
Sure, absolutely. So, as I mentioned, you have the freedom to see out-of-network providers that are not Blue Cross Blue Shield providers. So when you see a out-of-network provider, that provider must be recognized by Medicare. That provider would bill Anthem for their medical services. We would pay that provider the full Medicare allowable rate, less their $5 copayment. So even if you see an out-of-network provider, your responsibility for that visit will still remain the $5 copayment. What's important to note is out-of-network providers must bill Anthem. So similar to how they must bill, they bill Medicare, they would bill the Anthem Medicare Advantage plan. So if you're out of the New York area and you're in North Carolina, for example, you see an out-of-network provider, they're going to bill the local Blue Cross Blue Shield of North Carolina plan, who in turn would send it to us. We pay the provider directly. Out-of-network providers are not required contractually to do any of the prior authorization process. So what will happen is we encourage out-of-network providers to pre-authorize those services that may need pre-authorization, but if they don't do that, it will just be reviewed after the service is rendered, similar to how traditional Medicare retrospectively reviews a service. So the important thing to note is if you see an out-of-network provider, that doctor knows that the plan that you have is a national PPO program that has a passive component, which means your out-of-network benefits mirror your in-network benefits. So quite often these providers are confusing plans with the individual market. So it's important for you to let them know this is a group plan that's offered through my school district. It's a national passive PPO plan that allows me to see out-of-network providers, because that's typically where the confusion comes in.
So,
with regards to, it's up to the out-of-network provider if they're going to bill Anthem, correct?
Thank you. I just wanted to clarify that if that out-of-network provider, it's their responsibility or their decision of whether they bill Anthem or they can say we're not going to bill directly and have the member pay up front. What happens in that scenario where at the end of the day, the member still has the same $5 out-of-pocket?
We want to avoid any member having to pay up front for any service and get reimbursed. So if there's a provider that says, well, I'll see you, but you're going to have to pay me first and then get reimbursed from Anthem, you would be reimbursed from us, but we don't want that. We don't want the member to be caught in the middle. So if you ever come across a situation where the provider says, I want to be paid up front, please contact us so that we can outreach to that provider's office to let them know the proper billing process. 99.999% of the time, it's really just a simple education call to that provider's office, but we want to know about that. But if there's ever a situation where you did pay up front, you would be reimbursed the full amount of Medicare less that $5 copayment. And providers are not allowed to bill above the maximum Medicare billing limit. So you will never be balance billed for any excess charges from any Medicare provider. They're not allowed to do that.
do we have any questions for the audience?
My question concerns the mail order pharmacy benefit. At what point should we begin the transfer, when we get our ID card or the packet or after June 1? When is the best time to start that?
The question has to do with transitioning for the mail order program. When is the best time for you as a member to start taking action to transfer or get new prescriptions and get set up with the mail order program? What I suggest all members do is at the end of May, middle of May, contact your physician, let them know that your coverage is changing to the Anthem Medicare Advantage plan. You can provide the physician the phone number for the pharmacy line where they can actually send electronically the prescriptions into the Anthem Medicare mail order program. You won't be able to actually get them transferred or set up until June 1st. So I would suggest that you start the process the third week of May, have the conversations with your doctors so that they know you need new prescriptions and that they have all the information that they need so that when June 1st hits, they'll be able to set you up and get everything transferred over.
Thank you.
Just kind of tailing on his too, and I had my own question. Will that number be on our card? Because the one they sent through the mail through our district was not a real phone number. It was missing a digit. I tried it. You can't get anybody on it. So you need to have a whole phone number.
Okay, so the number that's going to be on the back of your ID card is going to be different from the number that's going to be in your pre-enrollment. The pre-enrollment number is before you're a member. So once you get your ID card, that will be your customer service phone number as well as your pharmacy customer service phone number and the 24/7 nurse line. So those are the numbers that are important post June 1st when you're a member. The first impressions phone number that you can call now, if you have any questions, it will be in your pre-enrollment guide that I promise you you'll get by Monday. Fingers crossed. It's 1-833-848-8729. So once again, that first impressions pre-enrollment phone number is 1-833-848-8729. And they can look up prescriptions to tell you what tier they fall under. They can look up doctors on your behalf. They can also answer any of your benefit-related questions that are specific to the Greater Jonestown plan.
Great. And my actual question was I live in the Saratoga area, so of course all my doctors are Albany Med. They've been sending me letters through the mail almost as often as the district saying, by March 31st, you should be enrolled in something else. So I'm wondering, am I now in insurance limbo for April and May? Do they not have to take my doctor or my Humana cards? Do they have to accept it or not?
You're not in insurance limbo. However, the question is in regards to those providers that were having contract negotiation issues with Humana, specifically Albany Med System, community care physicians. Their contracts are ending, depending on the group. Albany Med, I believe, is July 1, is their cutoff date. What's happening is, depending on the provider, they are willing to bill Humana on your behalf. At the end of the day, if you receive a service and that provider is not willing to bill Humana, you will be reimbursed from Humana less your copayment. But what I have found is, specifically with the Albany Med System, they've been pretty good about working with members. They're billing Humana directly for those services. Community care physicians is a different animal. Sometimes they're saying they will, sometimes they're saying they won't. So I've had other employer groups who've suggested if anyone has an appointment that's coming up, it can be pushed off until after June 1st. Something that's not of an urgent nature, to do so, to keep things smooth. But by all means, if you have an appointment in April and May with those providers, they should be billing Humana directly for those services. But if they don't, you would be reimbursed from Humana. They would be required to cover those services less their copayment.
though we're switching technically June 1st, that's not going to be a problem, even though they say there are these times you have to during the year if you're going to switch your Medicare plan. It has to be the 7th, the 31st, such and such. No problem for us?
There's no problem there. The providers are mainly focused in on members that are in the individual Medicare Advantage market so that they have Humana individually on their own, not through a group-sponsored plan. Those members have a special opportunity to make a move, but they have to do it within a certain time frame. So those dates don't apply to you. They apply to individual market members.
Thank you very much.
Yes, just to tap into that as well too. We've been working with Humana throughout this process, and we've seen information that's been out there provided by providers that's different than what Humana is providing. So just wanted to confirm for Albany Med, as Kim said, the termination date is 6/30. So any of those services should not have any issues with the transition. Community care physicians is 3/14, but they have agreed with Humana to see members as out of network, and that process works the same for Humana as Kim explained for Anthem.
Other questions?
If you're covered through June, and this starts first June, how do you get reimbursed?
Well, the coverage is switching over June 1st. So your Humana coverage is going to cover you through May 31st. And then effective June 1st, the Anthem Medicare Advantage plan will go into effect. So if you happen to have services that were rendered the end of May, for example, that Humana would be responsible for, Humana would still be responsible for covering those services regardless of when they were billed to the carrier. It's based on the date of service. So if you go to a doctor on May 30th and they don't bill Humana until June 3rd, Humana is still responsible for that visit because the date of service was prior to June 1st.
So I had a question way back.
I have two questions. If you have to go to Albany Medical Center in the emergency room, you really have a choice because of now. Does that cover it?
So a real emergency situation.
If it's with Humana and prior to the 6/1 date, emergency rooms, there are no in and out of network. Emergency rooms are covered in full regardless of in network or out of network. So, but the dates for Albany Med are going to be past the 6/1 date. So if you go to Albany Med at 5:30 and go to their emergency room, it would be covered by Humana. If you go to Albany Med on June 2nd or June 1st, it would, through the emergency room, it would be covered by Anthem.
Now, another question. If you're currently receiving home health care services from Marquis, which is Humana, does that continue or do you have to go through a whole total reevaluation?
The question has to do with a member who's currently receiving home health care services through Humana's preferred home health care program. The home health care benefit will be covered under Anthem. What's incredibly important is if you're currently receiving those types of services, whether it's home health care or scheduled infusion therapies, any type of service, continuous service that you're receiving right now, it's very important that you let the provider know that the insurance coverage is changing from Humana over to Anthem's Medicare Advantage plan for June 1st. The likelihood is you'll be able to use the same provider, the same home health care provider. They would just need to know that they need to contact Anthem to bill us and to coordinate any type of prior authorization that may be required for certain services. So I would let them know in May at some point that the coverage is changing so that they can get in touch with us.
Is that covered the same as Humana?
Yeah. Yeah, so it's a zero copayment for home health care services.
Any other questions?
I thought with Humana, to get a drug. They wanted me to go down 4 levels, so this is not, but the others didn't work. So does that mean, since it's a specialty drug, that I'm going to have to pay $20 for 3 months now?
The question has to do with a specialty medication, and I'm assuming that you now want you to go through a step therapy protocol and prior authorization process.
Which resulted in my being sick for 2 months.
So what will happen is, if you are taking a medication that you had to go through a prior authorization or step therapy protocol with Humana, a lot of those same requirements fall under the Anthem Medicare Advantage plan. However, because you've already gone through this already, make sure that the provider knows they need to just get in touch with us to get that prior authorization done. You've already met those protocols and requirements already, so you're not going to start from scratch. However, the provider will need to contact Anthem to initiate the prior authorization for that particular drug. I wouldn't be able to tell you right now what your co-payment would be. It would depend on what tier it would fall under. So it would be either the $7 or $10, $0, $7, or $10.
But what happens if my provider is retired and I have another person then? I'm stuck.
With the same office stuff.
Is it in the same office? They have all of your medical records?
They might.
In this particular case, get in touch with the district and send her information to me, and we can do an outreach directly to you so that we'll take you out of the middle of it so that we can get in touch with the physician and let them know what they need to do.
Okay, thank you.
So if you have something that requires pre-authorization and it's a chronic condition that you get some sort of injection, say once a month, would it be best then to, instead of getting something at the 1st of May, wait and put things off so it can go and have this transition from one insurance company to another?
I would never suggest, I don't want anyone to push anything off that they need to have done. My advice is it's important that the providers know that the insurance coverage is changing. So that's the important component, is that they're aware that it's changing, because I do not want to have any members in a situation where there's a bump, where there's a delay because paperwork hasn't been done for that particular service. So that's why I'm always encouraging to be a little bit more proactive, let them know in May so that they can do what they need to do. Quite often, they've already gone through the whole process and medical requirements with Humana as your current carrier. Those requirements and guidelines are the same under Anthem. We just need to make sure that they're transferred over appropriately. And I do want to let everyone know, for anyone who is taking a specialty medication that does require prior authorization, you have a 30-day refill. So you're automatically going to be able to get that particular drug filled 30 days. So you're going to be guaranteed that. So it'll give your provider a little bit more cushion to be able to get the appropriate paperwork done during the course of June. So you're not going to be denied your prescription on June 1st. You'll be able to fill it for a 1-month supply while they work through the prior authorization process.
I have a question about the silver sneakers. I've read about all over the country. How about here in Fulton County? I just recently found out that the one shipped in Gloversville is not accepted anymore. Are there any places we can go?
I will reach out to our Silver Sneakers representative to let them know that we're having, in regards to expanding participation in this particular area. So I will see what we can do about getting in touch with additional Silver Sneakers locations. Greater Jonestown, there's other employers, other groups in this area that would be impacted by that. So I will reach out to Silver Sneakers to see if they can recruit other locations, or see if they can get that one back into the program. I'll reach out to Silver Sneakers to see what we can do to drum up more participating locations.
The gentleman is that?
I have one question and one comment. The question is, I was glad, and many of us were glad to hear you say that Albany Medical Center Group is part of your network. However, when you go on Albany Med's website, they don't understand. We see Empire Blue Cross Blue Shield. Can you get them to include Anthem so that those of our colleagues who aren't here are going to get confused so they look it up at Albany Med?
Thank you for bringing that up. In all the other meetings, that was the first thing that I opened up with. Anthem Blue Cross is Empire Blue Cross. It's the same. Albany Med has not updated their website, so when you see Empire Blue Cross, that is Anthem, that is the Anthem network. We have reached out to Albany Med to ask if they could please update that or even put like a slash so that members know, because some people think, well, my doctor accepts Empire, they don't accept Anthem. Yeah. We've reached out to them to see if they can update it, but just so you know, Anthem is Empire.
And my comment is, I would like to thank and commend the district for being so proactive. I think a lot of us got the phone calls and letters that we weren't going to be covered because of part of the Albany Medical Assistance Service. And particularly, Steph Cowrie and Jack Inclusive were extremely helpful in great ambassadors.
Thank you for that, because as much as we try to communicate, and I thank all of you who have given us your email address. So I'm going to put the plug in now. If you haven't provided an email address, it's really important that we have it, because so much of this information has been very timely, and so it's hard sometimes to mail letters that by the time you receive it, especially if you're out of state, maybe somewhat outdated, so that we can ensure that we're communicating with you in a timely manner. If we have an email address, if you can give it to Deb, that would be really helpful. But I have to say, as Jason mentioned, we have followed these negotiations for months very closely to the degree we could. But, what really prompted this decision was the impact on our geographic area here in terms of the loss of providers. So we wanted to ensure a smooth transition too. But as Kim mentioned, between the First Impressions line, who's dedicated to this group, so it's not that you're calling a 1-800 number and you're one of thousands, across national that has this plan. This is a line specifically geared towards our group under this plan. But besides that, continue to reach out to us. Deb tends to be our point person for retiree health insurance. So as much as we're communicating with you, please know, once again, after you leave this morning, if questions come up, send us an email, reach out and call, because that also helps us gauge, geez, should we schedule another session? Should we put another mini meeting together where we can pull a bunch of you into a meeting and we can have one conversation to continue to pass on this information as we move to the June 1st. And even after June 1st, we're here to assist between the district and the First Impressions lines. Thank you.
I was talking about Albany Med. Is local places like St. Mary's still included?
Yes, they are participating in the network.
The local facility that really impacts this area, and I'm surprised we got more Albany Med than that is Nathan Latour Hospital. And I believe they're very close to signing their contract with Humana. But again, as Alicia mentioned, we've been monitoring this since day one in terms of these contractual negotiations. We had weekly meetings with Humana for updates. Haven't seen in the industry this type of exodus from a group of providers with the carrier specifically, with the between Anthem, the district's HR, the work behind the scenes in terms of getting a product that matches your benefits and is very close, if not a little less in premium, is a huge accomplishment. And again, so understanding that, and the comment is very meaningful in terms of the work behind the scenes, even though it's very stressful, to make it as seamless as possible for the John Scott retiree population. And again, having these meetings and continuing to have them as well, too.
Any other questions that you may have?
Just out of curiosity, they, Humana have that whole option there, 365, where you get reimbursed for preventative care? Does Anthem have that?
The question has to do with the Humana, I guess, 365 wellness program. We do not, Anthem does not have it for 2024. We are working to add a program similar to that for 2025. So, hold on.
I have a dental question. It says you cover cleanings. Is that all types of cleanings?
It's not the full periodontal cleanings, so it's your routine cleanings. So you get 2 routine cleanings, an exam, and a full set of x-rays each year. But if you do have a full periodontal cleaning, the Liberty Network dentist would offer that service to you at a discounted rate. So you'll have a portion of the cleaning covered at the zero copay, and then the excess charges would be discounted at their contracted rate.
But if you went to your own dentist, they would charge you the full shot and the shot.
Correct. They would be able to cover a portion of the periodontal cleaning as a routine cleaning, and you would get 70% coverage for that. But the likelihood is the majority of the bill you would be responsible for.
We have another question, way in the back.
With eyeglasses, you know, receiving your eyeglasses, getting prescription for your eyeglasses, and how that's going to be
vision prescription.
The eyeglass, the eyewear allowance of $200 every year is administered through Blueview Vision. So you can find out who the Blueview Vision providers are on anthem.com, or simply call the First Impressions phone number. They'll let you know where you can fill your prescription, and then you would have the full $200 allowance towards those eyeglasses, and you would just pay whatever balance above that you would be responsible for. Cataract surgery is covered under the program in full, and as well as your cataract eyewear that you would need after surgery. So that would be a zero copayment. So cataract surgery is covered under the program.
I know I missed you last time.
Under the dental program, you're talking about cleanings and x-rays. Do you have anything like for fillings or dentures or any?
The dental benefit
Sorry about that.
The dental benefit is preventive dental only. However, if you have additional services rendered in Liberty Dental office, so if you have fillings or crowns, you'll be able to get those services at the discounted Liberty contracted rate. So there's no coverage for it, but if you utilize a Liberty dentist, those services are covered at a lower fee. So if any retirees have a separate dental program through maybe, a CSEA or something like that, that's a comprehensive dental plan. Keep that. That program would cover for those types of services, but I don't know who would have that, and that would be something they would have on their own, not provided or paid for through the district.
With cataracts, you said it both, but there's 2 levels or 2 types of cataracts. Are both covered?
What do you mean by 2 types?
You either can have the doctor take a scalpel to your eye, or you can have it done laser.
Cataract surgery, we follow the Medicare guidelines for that. So if it's Medicare covered service, it's going to be covered. We cover both types. What we don't cover is the lens implant. So if you're going to have lenses implanted during cataract surgery, Medicare doesn't cover that, and the Medicare Advantage plans would not cover that.
Which would have been the same for Humana.
It would be the same same with Humana.
They paid for mine, and mine too. Humana did.
It may be a special type of lens.
Special ones.
I know when my mom had it done, Medicare didn't cover it. We would follow the same guidelines that you had followed. So I'm not an expert on the various levels of cataract surgery, but we would follow the same process that you had with.
That CMS phone call that you're going to get, how do you know that's CMS and it's not some scam? It's not a scam, it's just not trying to get your information from you.
In regards to the health risk assessment phone call that you'll get from us,
Whatever it was.
what you can do is if you don't want to take the phone call, you can, they'll send you a postcard in the mail. So if you're not comfortable accepting a phone call, and they're not going to ask for personal health and personal, like social security, they're not going to ask for that information. But if you're not comfortable taking the phone call, then don't take the phone call and wait for the postcard to come in the mail. That will give you the phone number that you can call in directly to.
And could they always make a proactive call in to Anthem? Say, hey, can I get the information or do the health risk assessment?
Yes, they can call the customer service number that's on the back of the identification card to get the phone number to complete the health risk assessment, or you can just wait until you get that card in the mail.
This is probably a district question. I'm concerned about the payment. Some of us have to pay upfront to the district for our payment. Others, we're on different contracts. And can we anticipate any sort of cost change or what may happen?
Actually, there's not much of a cost difference. Actually, this plan it's only a couple dollars less.
Okay.
So what we'll do is we'll reach out in May. And basically what we're going to do is the same thing how we're just transferring plans. We're just going to transfer your payments to the new plan. And it might just be, I think this plan was about $2 less a month. So it's very comparable in cost. But we'll send out communication in that May timeframe with anything about payment information and how it'll transfer over.
And that's very individual depending on when.
It does, yeah, but it depends on the contract in which you retired and
Right.
what type of plan that you're on. Also, as part of today, what I can mention is that one of the changes that we're making as a district too, and really trying to be more inclusive for our retirees as well as our actives, is we are including our retirees in our annual open enrollment. So you'll be getting information on that. So the Board of Education recently adopted an updated policy that more explains how the district covers insurance into retirement. So we can share that with you, but we do open enrollment in that May timeframe through June. So there are decisions that you can make applicable to the contract in which you retired. So if you retired with your health insurance and you retired with dental, let's say, or maybe you were eligible for dental and you didn't take it, there's open enrollment opportunities now, just like our active employees have, where you can make those decisions on an annual basis.
And that would be emailed to us or?
Correct. We usually email because it's the sort of the fastest route that we can do. So that's why we're really encouraging everyone to have an email address on file. And if simple as email Deb and she has a master list going with everyone's email addresses, that's usually the best way for us to communicate. So we'll send more of that out in the beginning of May timeframe in terms of open enrollment with information as well as payments moving forward. But you're not going to see any large swings in what you're paying currently. Like I said, I think this plan's about $2 less a month. So for us, it wasn't about the cost. We wanted to make sure, of course, the cost didn't increase, but we were more concerned about matching coverages and ensuring that your providers were included under the Anthem plan. Those were our two biggest priorities, other than ensuring a smooth transition over to Anthem. Any other questions?
Why do they Anthem instead of just Blue Cross?
Complicated question. There's the parent company for all of our health plans is Anthem, and it could be Anthem Blue Cross, it could be Anthem Blue Cross Blue Shield. It would keep things simple if it was just Anthem, but the issue is there's multiple Blue Cross Blue Shield programs throughout the country, and not to bore you, but there's a lot of Blue Cross Blue Shield Association rules as to what we can and cannot call ourselves. So, long answer is a legal issue.
Any other questions? So again, I want to thank you all for coming and those participating virtually for attending this morning. Again, if you leave here this morning, we will follow up with information to you, and we'll also put the information on our website from today. But if you have any questions, please give us a call during this transition. Let us kind of bear some of the, as Kim mentioned, some of the transition between providers. We can certainly assist with that. We don't want you feeling stressed over these next couple of months as we switch over. So please reach out to the team here if there's anything that we can help you with after you leave today. So thank you very much. Have a good rest of your day.
Thank you so much.
Take that.